Hello, everyone, and welcome, Soram. I'm so glad to have you today on our program. If you'd like to start by giving just a quick introduction to yourself, and then I'm super excited to dive into this content today.
Yes, thank you very much for having me, Stan, Nancy, and team. So my name's Soram Patel. I'm a NHS doctor, so based in the UK. I did surgical training, specialising in colorectal surgery, and then joined industry, working through first sort of healthcare partnerships programs in life science, and then most recently at AstraZeneca, where I'm part of the medical team, where our bold ambition is to transform care focused on respiratory diseases.
And on the topic of the symposium, kind of brushing against the value-based care topics, can you explain what value-based care means to you and how it's influenced your approach to healthcare delivery and treatment services?
Yeah, I probably have still very much the clinician view at my core, but I think that's important to bear in mind. So when I think about value-based care, it's interpreted differently to different people. So whether each sort of, I guess, role within the health system, so patients, healthcare professionals, health systems would interpret differently. But I think fundamentally at the core, it's the benefit that you see in the care being delivered, and linking it very clearly to outcomes. So what your perceived value is from that based on the outcomes that you receive, what you pay for it, or the cost of that. That is what value-based care is to me.
Yeah, and what strategies have you implemented in your practice to enhance value in healthcare, considering your background and your experience as well?
Yeah, so I mean, taking both sides of the coin, I think what uh, is really important to bear in mind in terms of strategies is understand what that value is.
Mhm.
We often think, and I say this in a world where we're developing medicines, we're developing technologies, you think it's going to be adding benefit to someone's life, to some health system, to ministries of health and governments in a certain way. But actually, until you really go out there and find out what that is and understand it from like a data, what that is also today versus in the future, those are like key aspects. And I think at the heart of it is the patients, because at the end of the day, the healthcare, like when you need it most, that's when you're a patient for your families. So that understanding what that real value driver is a critical and kind of the core of any strategy around
Yeah,
delivering
and when
value-based care.
talking about talking about, understanding that value, how do you feel you can measure and assess the success of value-based care initiatives? Do you have any specific examples from your career?
Yeah, measures is a great one. So I really hang on. People often sort of come back to, and this was my patients in practice, and I was working in oncology, and then even more recently, sort of in the respiratory space. If people think about how long that they've spent time, sort of the time that they've taken to get to the diagnosis or treatment, that's often a critical piece when we think about value, because even in like it when you sort of extrapolate that up, yes, that might be a time sense, but then that time adds resource, that adds cost, like finances, that time adds implications on what sorts of services have to be implied. So I think it's sort of that's my key example. So understanding what the time to treatment in whatever disease area that currently is, and then also benchmarking. Sort of those are my kind of like, if you're going to do one thing, do that really well or know that about your disease area, about your health system.
Yeah, and I wanted to kind of, as someone involved in sharing these best in class practices globally, what are some key practices or approaches that you believe have universal applicability in improving healthcare outcomes?
Yeah, very good question. I think we're always really quick to shout about, I'm doing this really great thing, but what takes an idea to actually like
Mhm.
evolve it to something that someone should really invest in, and prioritize in the crazy busy resource constrained world of healthcare is something that's really different. Healthcare is always going to be a very evidence-based practice. So I think in terms of those like examples of practice, like leading by outcomes. So I've got sort of patient identification, like case finding tools that demonstrate what that value is, like that you've got improved symptom control, that you've managed to improve someone's quality of life. But it's not enough to just say, yes, I've done that. Okay, we have done that in many countries across developing and developed countries, but you need to go and really put that into paper and evidence base it. So I guess just one example, when I was working in a hospital in New York, there was a teaching program. It got great outcomes. The patients just the trainees went and improved patient care, like the patient symptoms, quality of their experience of surgery, everything improved. We literally lifted and shifted that to the UK, but what we critically need to do is put that into a white paper, take that to Congress, like make sure that that's sort of cemented and get people's feedback on it in order to do it. So I think that's a big piece of things.
Yeah, I was just curious thinking about that. I was wondering if you had ever, implemented a practice from another region that made a notable impact on the healthcare delivery in your current setting, but you kind of answered that with saying how you kind of implemented stuff from your time in New York. So, has there been any other, instance where you've had something that really has really impacted your career based on something you've learned, outside of the UK?
Yeah, I mean, there are many, and I think it often you want to think that you're not reinventing the wheel. There's a lot of like we kind of have centered on like resource constrained world, like there's no point developing something. So there are so many in terms of like algorithms for sort of clinical decision making. Yes, you can tweak and adapt them. And I think a lot of the critical part is not just the development of that, but actually how you implement it. So I think certain things that we've seen work in sort of gold standard sort of clinical decision making, what's really like underneath the bonnet and the kind of rudimentary start versus then how it gets developed to actually being embedded within an EMR, electronic medical health record, something like that, and actually translate it into practice. Those are things I've sort of been involved with, and often it's just taking that bones of that like simple list of key questions you need to ask that we've taken from like Europe and sort of key European markets, but then you can then take that to sort of developing markets. You might not have the sophisticated electronic medical record, but you don't need that to improve patient outcomes. You need that kind of like validated list that's very simple that someone in their primary care practice or their local hospital where they're resource constraint can do that will actually save lives and actually save health systems money, enable them to offer better care to more patients.
Well, that's amazing. Thank you so much, Soram, for just always, giving us your insights. And it's so interesting to talk to you every time and learn about, what you're doing and kind of what you feel like is truly like a value-based care approach. So thank you so, so much for joining us today. It was a pleasure to have you.